Kenya is now at the center of a global attention following reports that the United States is considering setting up a quarantine facility in the country for American citizens exposed to Ebola during the ongoing outbreak in the Democratic Republic of Congo and Uganda. The Kenyan government has not confirmed or denied the claims. In a statement to newsrooms, the Ministry of Health has insisted that the country is open to partnerships that strengthen health security and reaffirm shared commitment to protecting lives through coordinated science-based action. We begin tonight with NTV's Helen Aura.
Sources have intimated to NTV that the United States government is in talks with the Kenyan government to set up a quarantine facility which will host Americans considered high risk or those who have tested positive for Ebola from DRC and Uganda. The development has sparked mixed reactions among Kenyans and health stakeholders.
When you're talking about having a quarantine station in this country, well, it's a good move because it's actually going to give as rather an opportunity to be able to do a lot of things. But then before we do that, before it happens, we need to ensure that we have the public health infrastructure properly embedded, properly constructed. And we also need to be very cautious because we are looking at the risk levels. Remember, I've said that Kenya has not confirmed any EVD disease. We need to make sure that we need to have scientific evidence to prove that this deal is not going to bring another exposure or the risk levels of our Kenyans.
On the other hand, the Ministry of Health has maintained that Kenya currently has not confirmed any Ebola case, but maintains that the country is on high alert.
We have put all measures in place along our borders. We have put scanners. At the airport, we are doing a very serious screening of all passengers entering our country, and most of those who have either coming from Uganda or who are on transit through Kinshasa.
A statement that now seems quite contradicting following the situation in Busia County.
Watu wanapimwa tu magari peke yao kwa mabuses na watu wa kutembea hawapimwi. Na inafaa waweke vipimo kila mahali hata kwa makodokodo ili watu waweze kupimwa. Babu hapa kwa mpaka makodo ni mengi sana, watu wanapita bila kupimwa.
Juu hii Ebola vile imekuja, sisi tunabeba dereba wa matrela wenye anasafiri kutoka nje mbalimbali. Tunaomba serikali ikuwe na mikakati ya kutupima sisi kama boda.
The proposal to quarantine American citizens in Kenya is a stark contrast to the way previous administrations responded to outbreaks during which healthcare workers and other U.S. citizens exposed to the virus were flown back home to be treated at specialized medical units. Recently, an American doctor who developed symptoms was flown to a hospital in Germany.
We're actually looking at a situation whereby we're actually going to have more PHOs being employed in those quarantine areas to be able to help us run the risk, able to lower the risk, and also provide health education to the travelers and all other people actually surrounding ourselves. So to us, we see it as an opportunity for us to be able to partner with the United States of America, only that that partnership should be in tandem with the existing public health laws.
According to a statement by the Ministry of Health, and I quote, the government of Kenya notes ongoing discussions with the U.S. government and other global partners regarding international collaboration on strengthening preparedness and response mechanisms for Ebola virus disease and other emerging public health threats. Kenya welcomes partnerships that strengthen global health security and reaffirm our shared commitment to protecting lives through coordinated, science-based action. End of quote. The Ebola outbreak in the Democratic Republic of Congo is estimated to have ballooned to more than 1,000 cases and more than 200 deaths. Uganda has recently closed its border with DRC to contain the escalating outbreak. Helen Aura, NTV.